Hey, what's up guys? So today we're going to talk about what to expect during the first 2 weeks following your total knee replacement surgery. We're going to talk about what to look out for, what our goals should be in that time frame of 0 to 2 weeks. And I'm going to introduce 5 very simple yet very effective exercises that you can do at home as soon as you come back from the hospital to help with your rehab process. It's extremely important to regain that range of motion as soon as possible because the longer we wait, the more that scar tissue adhesion will tighten up our knee joint. Alright, so first things first, let's talk about pain. It is completely normal to feel some pain and discomfort following your total knee surgery, especially in the beginning stages of rehab. With that being said, our goal shouldn't really be to get rid of pain completely, at least in the very beginning stages, but rather we should be able to track that pain tolerance threshold over the couple days or couple weeks of rehab so we can see that we're going the right way. And we can also track that pain tolerance threshold, sorry, that's a big word, so we can increase it as the time goes on, increase it gradually so we can participate in much higher intensity exercises that can benefit us better. You should also regularly check and monitor your incision site for any signs of infection if necessary. So look out for any signs of swelling that does not go away for a couple weeks and months. Any pain that doesn't go away for quite a bit of time. Any drainage that it doesn't seem very natural. If you see any of those, or if the joint feels too hot for a long period of time, you should definitely consult with your healthcare provider. Also, in most cases, it's important to note that you're probably going to be weight bearing as tolerated, meaning you can bear some weight on that operated leg as you can tolerate it. That doesn't mean that it's completely safe for you to be walking around. So if you need to be using any assisted devices like crutches, cane, walker, wheelchair in some cases, very rarely, you should familiarize yourself with those assisted devices and make sure that you can transfer or ambulate safely. Swelling and edema should gradually decrease over time if we're on the right track for rehab, but rest, ice compression, and elevation is always a good method to decrease the swelling as much as we can so we can start participating in more higher level range of motion or strength exercises. Alright, so let's go over these 5 exercises that you can do at home like I promised. You do not need any special tools or equipment to do these exercises. I kind of designed them that way on purpose so you can start doing it if you're watching this video after your total knee replacement surgery. Alright, so the first exercise that we can do is called a quad set. Think about squeezing your thigh muscle, and that's going to help strengthen our quad. And what that does is really help with everyday activities like walking, sitting, standing, and just about anything else. Think about holding that position, holding that squeeze for about 2 to 3 seconds before you let go. And you can try to do this for about 10 to 12 reps. The next exercise is called straight leg raises. This is an extension of what we were doing with a quad set. So think about squeezing that thigh muscle, and now you're just gonna go ahead and lift your foot up from whatever surface you're on and then putting your leg back down. All right, so this next exercise is fairly simple. It's a good precursor to walking, and it's called anterior and posterior weight shifting. In split stance, you're basically shifting your weight back and forth so you feel more comfortable bearing weight on both legs. If that's too easy for you, you can start by actually taking a step forward and then taking a step backward. Next exercise is called lateral stepping. So here we're not only tackling that sagittal plane movement, meaning moving forward and backward, but we're also tackling that frontal plane movement, moving side to side, because we do move side to side during our everyday activities. All right, the last exercise is called sit to stands. This is literally going from sitting on a chair to standing back up. A very good precursor to squats, which helps strengthen pretty much all our muscles in our legs. And it's also very functional because you should be able to go from sitting to standing safely.